Hi everybody, I'm gonna present the Harmonic Study today. Harmonic stands for How are the Arab rheumatologists dealing with the COVID-19 pandemic. This is an initiative by a steering committee from ArLAR. We decided to do this study because the pandemic is a challenging time for all of us due to the patients who are immunocompromised and vulnerable, to the symptoms that overlap between rheumatic diseases and COVID-19, to the difficulty of applying telemedicine, and to the shortage of rheumatology drugs. The objectives were to determine the impact of the COVID-19 pandemic on the rheumatology practice in the Arab country. The steering committee designed a 21 items questionnaire which was validated by the scientific committee of ArLAR. It was then disseminated in May 2020 to all ArLAR rheumatologists by email and on social media. The ArLAR countries are 15, comprising more than 3,000 rheumatologists, most of them based in North Africa. Let's jump to the results. Among the 3,000 rheumatologists, 858 were included in the analysis. The participants were 50% from North Africa, 30% from Lebanon, and 20% from the Gulf. And the top recruiters were Egypt, Iraq, and Carey. The participation rate by country was 27%, highest in Lebanon, 68%, followed by Gulf and North Africa. The age category 35 to 44 comprised most of the participants, and 60% were female. The rheumatology practice sector was mainly public in the Gulf, as you can see here in blue, mainly private in the Levant, as you can see in light green, and mainly university hospital in North Africa here in yellow. Institutions were implicated in COVID-19 management mostly as a frontline institution in the Gulf, mainly, partially involved in the Levant, and not involved mostly in North Africa. The rheumatologists themselves were involved in frontline management of COVID-19 in around 30% in the Gulf, 22% in North Africa, and 18% in the Levant. The impact on the practice. As you can see from this graph, the impact on the outpatient clinic was very high, 65% in dark green. It was highest in the Gulf, 76%, and lowest in the Levant, 53%. The impact was also high on day hospital or infusion center, 56%, and on the regular hospital, 69%, mostly in North Africa. This was associated with a reduction in the income, so in 43% in all the countries. The factors that were associated with a higher impact on the outpatient clinic activity were the region, mostly in North Africa, using telemedicine, impact on income, and it was inversely correlated with the private sector. So people in the private sector had less impact on the outpatient activity. The impact on hydroxychloroquine availability was also important. There was a difficulty of access in 24%, a shortage in 47%, and it was higher in North Africa. Rheumatologists were also personally infected with COVID-19. At the time of our study in May, 15 rheumatologists were infected, mostly so 5 from the Gulf, 5 from the Levant, and 5 from North Africa. And 1/3 of these rheumatologists were involved in frontline management of COVID-19. The mental impact was also important. It was major in 16% and minor in 60%. Only 23% didn't have any impact on the mental health. About preparedness for frontline application, 25% said they were totally prepared, 45% were partially prepared, and this was highest in the Gulf. How about telemedicine? Telemedicine was mostly used in the Gulf and less used in the Levant. It was reimbursed only in 12% overall, highest in the Gulf and lowest in North Africa. The agreement to use telemedicine was also low. Only half of the rheumatologists would agree to fully fully agree to use telemedicine, 24% agree only if it's reimbursed, and 22% do not agree to use telemedicine. So the take-home messages of this Harmonic study were a high participation rate, 27%. Responders were young, females mostly, and there was a significant difference in practice between the three regions, and 39% worked at institutions that were implicated in the frontline management of COVID-19. The impact on rheumatology practice was significant, 65% on the outpatient clinic, 69% on the hospitalization, regular, and 56% on the day hospital. Drug shortage made mainly hydroxychloroquine, 71%, a global mental impact of 77%, an impact on income in 43%. So a non-negligible rate of infection was seen among rheumatologists and also among patients. This impact was associated with the region. It was worse in North Africa with using telemedicine, with worse impact on income and less impact in private sector. Finally, about telemedicine, 73% already use some sort of telemedicine. It is reimbursed only in 12%, 54% agree to use it, and 24% agree to use it only if it's reimbursed. And we came up with suggestions based on the unmet needs that we identified in the study. The top 5 unmet needs were access to drug, 2, telemedicine platform, 3, personal protective equipment, 4, patient education, and 5, medical education. So our steering committee recommend working with health authorities to guarantee the availability of drugs for patients with chronic rheumatic diseases, would discuss the modalities of telemedicine and its legal framework of implementation in the Arab region, suggest also to work with health authority to guarantee the availability of personal protective equipment for healthcare professionals, suggest to develop unified guidance for rheumatology patients during the pandemic, the transitional deconfinement period, promote channels of patients' education and advocacy for rheumatology, and finally develop unified practice guidelines for the rheumatologists in the Arab region during the pandemic and the transitional deconfinement period, and also promote continuous medical education. And with that, we would like to acknowledge the steering committee, the ArLAR members who helped in recruiting, the independent reviewers, and we would invite you to read our study published in the Clinical Rheumatology last month, and to join us to check out the abstract at the next upcoming ACR. Thank you for your attention.